Acute epiglottitis. It's also called supraglottitis. Supraglottis means above the vocal cord, and acute epiglottitis is a life-threatening inflammation of the supraglottic structure, which includes the epiglottis, the epiglottis, and the arytenoid. And this inflammation may lead to airway blockage. And remember that it's not only the inflammation of the epiglottis, rather it involves all the above mentioned structures. Epiglottis is primarily composed of fibroelastic tissue, and it's shaped like a leaf and found behind the tongue and above the larynx. And it communicates with the surrounding structure with soft tissue. There is a basic anatomic difference between children's and adults' epiglottis. In children, epiglottis is found more superior and anterior, and it's more oblique with the trachea. In addition, in children, epiglottis is more floppy. Because of all these reasons, airway obstruction and compromisation is more severe in children, and it's dangerous. The cause for acute epiglottitis is usually bacterial cause, but it can be preceded by a viral infection. The etiologies for acute epiglottitis before vaccine introduction, it was commonly by Haemophilus influenza. The other most common cause is group A streptococcus. Clinical features. It's more common in the age between 2 up to 7 years. There will be abrupt onset and rapid progression. Sore throat and dysphagia is more common in adults, whereas dyspnea and stridor is common in children. There will be high-grade intermittent fever. Remember that in children will appear more toxic and they present in sniffing or three-point position. This is because it will maximize the airway. Drooling. Diagnosis. With tongue depressor, red and swollen epiglottis will be seen, and with indirect laryngoscope, swollen, edematous and congested epiglottis and supraglottic structures will be seen, and this should be done in operating room. Lateral soft tissue X-ray of the neck shows swollen epiglottis. Drooling is also the other most common features in children. Treatment. The treatment for acute epiglottitis is inpatient, especially for children, because they may deteriorate rapidly, and avoid anything that may irritate the children, because it may worsen the obstruction. Immediately start IM or IV antibiotics, especially ampicillin or third generation cephalosporins like ceftriaxone. And also sometimes steroid can be used, which will decrease the edema and relieve the obstruction. And most commonly used steroids include hydrocortisone and dexamethasone. The patient should be well hydrated. Humidification and oxygen may be required. Sometimes intubation and tracheostomy may be done if the obstruction is severe and not relieved. Thank you for watching, and don't forget to subscribe.